Now, for a sense of where the health care debate is going in the Senate, we're joined by Republican Senator Orrin from Utah and Democratic Senator Arlen Specter from Pennsylvania. And Senator Specter, let me start with you since you were in the rhetorical line of fire in town halls throughout the Keystone State this week. Let's take a look.
You're a socialist, fascist pig.
Go back to Washington, D.C. and tell those people to do what the president said that I should do, is shut up and get out of the way.
One day God's going to stand before you, and he's going to judge you.
There is nothing un-American about me.
That's a lot of anger. Where does it come from, Senator Specter?
A variety of factors, Jake. I think people are very nervous because so many have lost their jobs. And I think that the uncertainty of the health care bill, remember, we don't have one in the Senate yet, and none has come to the House floor, but I think we have to bear in mind that although those people need to be heard and have a right to be heard, that they're not really representative of America, in my opinion. We have to be careful here not to let those town meetings dominate the scene and influence what we do on health policy. There are a number of issues here. One is that while they are organized and have a right to be organized, as John Podesta has pointed out, there's a real effort here to make this the president's Waterloo. That was stated specifically by a Republican senator. And we also can't allow these kinds of town hall meetings to dominate the political process. That would be destructive of what we need to do to figure out what is the best approach.
Well, Senator Hatch, let me go to you. Speaking of dominating the political process, former Alaska Governor Sarah Palin referred to a provision in the House bill as a death panel. Your colleague, Alaska Senator Lisa Murkowski, said this in response to Governor Palin.
It does us no good to incite fear in people by saying that, you know, there's these end-of-life provisions, these death panels. I'm so, quite honestly, I'm so offended at that terminology because it absolutely isn't.
Senator Hatch, who's right, Governor Palin or Senator Murkowski?
Well, Jake, I don't think I'm going to make that decision. You know, there are many different people who have many different opinions on what is meant by these programs. But what I do know is that the Democrats want a government plan where the government will take over health care. They want to cut Medicare in order to pay for that plan, even though Medicare is $39 trillion in unfunded liability. They want to do a number of things that I find objectionable, such as an employer mandate, a job-killing employer mandate that hurts people on the lower spectrum who really are low-income wage earners. They want to move, according to the Lewin Group, up to 119 million people into Medicaid. If that happens, it would destroy the health insurance programs throughout the country. 8 out of 10 Americans really want their health insurance coverage. They don't want to lose it. In fact, 64% would prefer health insurance to the 19% who say that they would like a government plan where the federal government, nameless, faceless bureaucrats, set what the terms and conditions are of our health care system. Having listened to Arlen, I have to say that I thought Arlen handled his town meetings very, very well. I disagree with Arlen that they're not representative of the American people. I think they are. I've found people just up in arms everywhere I've gone on health care. On the other hand, I compliment Arlen for the way he handled it. He showed respect for the folks who were there. And look, there are people on both sides who are attending those meetings. Don't think the unions don't have everybody they can get there. And the Democratic National Committee, they're encouraging people to get there, as well as, I'm sure, Republicans. The important thing is that we handle it well, and I want to compliment Arlen on that.
Well, Senator Hatch, if I could just stick with you for a moment. In 2003, when you voted for a Medicare reform bill, part of that bill required a care management plan for a targeted beneficiary, which shall be developed with the beneficiary and shall include the following: the provision of information about hospice care, pain and palliative care, and end-of-life care. If the government has no business telling the American people that they should engage in end-of-life consultations, as many in your party seem to think is the case, why did you support that?
Well, every doctor that handles senior citizens, both my parents were 89 years of age when they died. Every doctor that handles those works with end-of-life care. I mean, we expect that. But where people are concerned is that with a government plan, keep in mind the Democrats want to have an IMAC. That's an independent Medicare advisory council of 5 people appointed by the president who will determine what kind of health care you're going to have. And guess who they're going to have to ration? It's going to be senior citizens. And senior citizens are naturally concerned about that. So am I. And I think that's where these type of things come about. But when doctors give end-of-life care, I don't know any doctor who does that, who doesn't do it as well as he can.
Well, I think actually
he or she can.
I think IMAC is supposed to be recommendations and not determinative. But moving on, Senator Specter.
Well, that's what they want, Jake. That's what they want. That's what they're suggesting. That's what this administration is suggesting. In all honesty, I don't want a bunch of nameless, faceless bureaucrats setting health care for my aged citizens in Utah.
Senator Specter, is Senator Hatch describing the health care bill properly?
No. Let me come back to the question that Senator Hatch didn't answer. You asked him, did he agree with Governor Palin or Senator Murkowski on the basic issue as to whether the plan provides for death counsels. Senator Hatch didn't answer that. The fact of the matter is that it's a myth. It's simply not true. There are no death panels. And when Senator Hatch comes to his basic point that this is a government takeover, that's simply not true either. The government option is an option, pure and simple, and the private sector will be maintained, and people will be able to keep their current health care plan if they like it. And the employers can be given incentives to stay with the plan that their employees like.
Well, Senator Specter, let me stick with you, because about that government plan, the public option, in May you said you would oppose that. And you have changed your mind, and you, at least as I understand it, in town hall meetings, you're saying that you do support the inclusion of a public plan in a health care reform bill. What changed your mind?
Well, I really had only one question on a TV interview, and I gave a negative answer, but that was before. Listen, I don't want the kind of a bureaucracy that puts a gigantic bureau between the doctor and the patient, which some people have proposed, and I'm against that. And my negative answer really went to that. That was before Senator Schumer, for example, has come out with some specifics on a government option. And the government option, according to his plan, is going to maintain a level playing field. And the option is not going to force out the private sector. And I think competition is good. And it is just an option, one of many alternatives with the government option.
And Senator Hatch, you were at the negotiating table in the Senate with the Senate Finance Committee members talking about a bipartisan solution. You walked away saying you didn't think that a bipartisan solution, you could sign off on it. But let me ask you a question, because obviously one of the big...
that isn't what I said. That isn't what I said.
Well, tell me why you walked away.
I still think we should have a bipartisan solution, but what I can't tolerate is a government plan, and there's no way you can make it co-equal, have a government be on an equal playing field, because they have, the government basically, if we turn over this country's health care to a government plan, and we open up a government plan, the Lewin Group, one of the best analytical groups in health care in the country, if not the best, said that up to 119.1 million people would transfer from private insurance into the government plan.
Well, Senator Hatch, we should point out, first of all, the Lewin Group is owned by United Healthcare, although they insist
fine, but they're still highly respected.
Yeah, I'm not disputing that. But let me ask you a question.
Respected.
You are one of the chief co-sponsors of the state children's health insurance program, bringing health insurance through the government to millions of children. You've been heralded for that by liberals. At the time you introduced it, then Senate Majority Leader Trent Lott accused you of creating big government. What's the difference between the S-CHIP program on a theoretical basis in terms of getting the government involved and what you're now talking against?
The way it was originally designed, it was the Hatch-Kennedy bill. We wrote it together, and I have to say that that plan basically provided block grants to the states for the states, according to their own demographics, to set up their own child health insurance program. It worked amazingly well until the liberals started to push more and more Medicaid people into the CHIP program. and started to expand the CHIP program in ways that were never contemplated. We did CHIP for the only kids left out of the health care system, children of the working poor. Now it's being used to push Medicaid people into it, and everything that Democrats are doing is pushing towards what's called a single payer system, where the government basically controls everything. And this public plan, this public government plan, don't think for a minute that that will not destroy the current insurance system. 8 out of 10 Americans are basically pleased with their health care insurance. They'd like to improve it. They'd like to make sure that they have guaranteed issue and that people with pre-existing health care problems are taken care of. And we all want to do that. And 64% of them say they'd prefer that over a government plan.
Right.
And yet we're just pushing like mad to get a government plan here.
79% of the American people do say, though, that their premiums are too high. They pay too much. We only
they all agree with that.
We only have a couple minutes.
They all agree with that.
We only have a couple minutes left. I want to get both of you to weigh in. What needs to be done to contain health care costs? Senator Specter, what tangible things need to be done to bring costs down?
Just an introductory comment with Orrin's filibuster. I would use this program to invite Senator Hatch back to the bargaining table, back to bipartisanship. Senator Hatch is a very smart, experienced fellow. I've worked with him for a long time. Directly answering your question, what can we do to bring down costs? Many things. First, National Institute of Health Research, which I have pushed, cuts down on the mortality in many lines. Secondly, examinations, early detection on cancer. I was the beneficiary of early detection on cancer, which has solved my problem. Third of all, having a doctor examine so that you don't get involved in chronic ailments, which are so debilitating. Next, there ought to be criminal prosecutions that result in jail sentences, not just a fine on Medicare or Medicaid fraud.
And Senator Specter, I have to interrupt you. I'm sorry. We only have a minute left, and I want to see if Senator Hatch will take you up on your offer to come back to the bargaining table before we go. Senator Hatch,
I want to see too.
Do you want to go back to the bargaining table and make this bill better?
Well, I'm always ready to go back to the bargaining table. Heck, I've probably helped pass more bipartisan health care legislation than anybody I know. Hatch-Waxman, Hatch-Dodd, Hatch-Kennedy. You know, we've just had one bill after another, and then they work. And the main reason they work is because we rely a lot on the states. Utah is not Massachusetts. We don't want the Massachusetts plan imposed on Utah. Massachusetts is not Utah.
I have to cut you off there, Senator, but we look forward to you joining the bipartisan conversation. That's what we do here at ABC. We bring people together. Senator Specter, Senator Hatch, thanks so much for joining us today. We really appreciate it.
Jake, that's your answer. Bring Senator Hatch back.
Okay.
We'll have some bipartisanship.
Well, I'll try to get back if they'll open it up and do what's right.
All right. Thanks to both of you.